Back pain is a common condition that can greatly affect one's quality of life. While medication and surgery are often used to treat this condition, there are also many non-invasive methods that can provide relief. In this video, we will explore various techniques and lifestyle changes that can help alleviate back pain without the need for medication or surgery. From stretching and exercise to alternative therapies and ergonomic adjustments, we will provide a comprehensive guide to managing back pain in a natural and holistic way. Practice good posture. Maintaining good posture is a critical component in relieving and preventing back pain. Poor posture can put unnecessary stress on your back muscles, causing strain and discomfort. To maintain proper posture, start by aligning your ears, shoulders, and hips in a straight line while standing or sitting. When sitting, keep your feet flat on the floor and your knees at a right angle. Use a chair with proper back support or place a pillow behind your lower back to keep your spine in a neutral position. When standing, distribute your weight evenly on both feet. Keep your shoulders relaxed and tuck your shoulders relaxed and tuck your stomach in slightly to engage your core muscles. Additionally, avoid slouching, crossing your legs, or cradling your phone between your ear and shoulder. It may take some time and effort to develop good posture habits, but the benefits are worth it. Proper posture can improve circulation, reduce muscle tension, and alleviate back pain. By consciously maintaining good posture throughout the day, you can prevent further damage to your back and lead a healthier, pain-free life. Get a massage. Getting a massage is a great way to relieve back pain without medication or surgery. A professional massage can help relax and loosen tight muscles, reduce inflammation, and improve circulation. Massage therapy can also increase endorphin production, which are the body's natural painkillers, providing natural pain relief. Different types of massages can help target specific areas of the back, such as deep tissue massage that focuses on the deeper layers of muscle tissue, or Swedish massage that uses long strokes and kneading to promote relaxation. Other types of massages, such as shiatsu, thigh massage, or reflexology, can also be beneficial for relieving back pain. It's important to choose a licensed massage therapist who has experience in treating back pain and to communicate with them about your pain and any concerns you may have. Before getting a massage, consult with your doctor to make sure it's safe for you to receive massage therapy. Overall, massage therapy is a non-invasive, natural way to alleviate back pain, reduce stress and tension, and promote relaxation and overall well-being. Exercise regularly. Exercise is a powerful tool for relieving back pain without medication or surgery. Engaging in regular low-impact exercises like walking, swimming, or yoga can help strengthen the muscles that support your back, increase flexibility, and reduce pain. Exercise also stimulates the release of endorphins, which are natural painkillers that can alleviate back pain. When starting an exercise routine, it's important to start slow and gradually increase intensity and duration over time. Avoid high-impact exercises that can cause further strain on your back muscles, such as running or jumping. Incorporate exercises that target the muscles that support your back, such as core exercises, stretching, and low-impact cardio. Yoga is a particularly effective exercise for back pain relief, as it can improve posture, increase flexibility, and reduce stress and tension in the back muscles. When exercising, make sure to use proper form and technique to avoid further injury. Additionally, maintaining a healthy weight through exercise and a balanced diet can help reduce the strain on your back muscles, leading to less pain and discomfort. Overall, incorporating regular exercise into your daily routine can be an effective, natural way to relieve back pain and promote overall health and wellness. Try acupuncture. Acupuncture is a traditional Chinese medicine technique that involves inserting thin needles into specific points on the body to stimulate healing and reduce pain. In acupuncture, the body is viewed as a whole, and the goal is to restore the body's natural balance and energy flow. known as qi. Acupuncture has been used for thousands of years to treat various conditions, including back pain. Acupuncture can help reduce inflammation and muscle tension, increase blood flow, and stimulate the release of endorphins, which can provide natural pain relief. During an acupuncture session, the acupuncturist will examine your body looking for areas of tension and discomfort. They will then insert needles into specific points on your body, depending on the location and severity of your back pain. The needles are left in place for about 20 to 40 minutes, and you may feel a slight tingling or sensation of pressure during this time. Acupuncture is generally considered safe when performed by a licensed and experienced practitioner. However, it's important to consult with your doctor before trying acupuncture, especially if you have a bleeding disorder, are pregnant, or have a pacemaker. Get enough sleep. Getting enough sleep is crucial for maintaining good health and reducing pain. When you sleep, your body enters into a state of rest and rejuvenation, which allows it to repair damaged tissues and replenish energy stores. A good night's sleep of 7-8 hours is recommended by healthcare professionals as it ensures that you wake up feeling refreshed and energized. To maximize the benefits of sleep, it's important to use a supportive mattress and pillow that promote proper alignment of the spine and neck. This helps to reduce pressure points and minimize discomfort. By prioritizing sleep and creating a comfortable sleep environment, you can take a positive step towards managing your pain and improving your overall health and well-being.